I'm Dr. David Beaulieu, and I'm back with more news you can use. And I was reading a study today that I just found fascinating, and it's a perfect example. It is a perfect example of what these huge corporations, of what these huge groups do. As the sugar industry has subverted public health policy. Who would have thought? For decades, the sugar industry dramatically altered and shaped the research agenda of the National Caries Program. That has to do with cavities in teeth. The sugar industry dramatically altered and shaped the research agenda. Launched in 1971 to identify interventions that would eradicate tooth decay. Well, we know that sugar is a major problem with tooth decay. We know that if we're looking for a major cause of tooth decay, sugar comes to the fore, and almost anyone in this country that you ask with any education will tell you that that's the case. And unable to deny the role of sugar in dental cavities, the sugar industry adopted a strategy to deflect attention to interventions that would reduce the harms of sugar consumption rather than restricting intake. Yeah, let's not affect our bottom line. Let's not affect profits. Let's keep the money rolling in, but let's focus on something over here so that people aren't looking at the damage that we're doing. Research into fluoride, which is what they pushed, has not only failed to support its purported benefit, it actually shows that the health dangers of fluoride far outweigh the marginal dental benefits, if there are any at all. And fluoride is a poison. And every few years, somebody gets too much fluoride and dies from it. It's a poison. There was a suit in Pennsylvania that demonstrated thousands of lives are cost every year in cancer related to the fluoridation of water. It went to court. One of the researchers, John Yamuyanis, was a fellow college student of mine at Rhode Island. We've known fluoride has been a problem for a long, long time. And recently, and this affects my practice, recent research has found a strong correlation between water fluoridation and attention deficit hyperactivity disorder. And my practice is 50 to 60% pediatric. I work with these children every day. And a contributing cause is in our drinking water. Let's get it out of there. It was put there as a diversion. Don't look at sugar, the underlying problem. Let's find something we can do to take the pressure off us, the sugar industry. So let's focus on doing something that will take the spotlight off us. Let's put the spotlight somewhere else. Let's focus on getting rid of these cavities. Let's use fluoride, which is wonderful for the aluminum industry because it's one of their dangerous byproducts. Now it saves them billions of dollars a year getting rid of a toxic byproduct. Let's dump it in the water supply. A dumb idea. Let's get the fluoride out of the water supply. It's doable. It's done all over the world. Most of Europe has no fluoride in the drinking water. Australia, New Zealand, these people have just said no. We can just say no. Let's get it out.